So kind of following up from your previous talk, in this next presentation of Stream 2, there's another aspect of the patient's role in health research, which is the patient education. And this will be the focus of the presentation by Ivo Schauwecker, President of EUPATI, the European Patients Academy on Therapeutic Innovation. So patient and public involvement in clinical research has the aim that research is done with or by patients rather than to, about, or for them. And this involvement requires the availability of willing and actually of patients that have quite some background knowledge. And in the talk by Ivo Schauwecker, we will now get insights into how EUPATI addresses this challenge. And Ivo Schauwecker, the floor is yours, and I hope everything will work fine.
Okay, thank you very much for your kind introduction, and also thank you for being invited to have a talk in that forum, and having the chance to extend a little bit on patient engagement in general. Allow me quickly just to add a few details. So I'm actually president of EUPATI Switzerland, which I will also point out through the talk quickly, the differentiation between EUPATI and EUPATI Switzerland. And in that function also maybe to clarify that that's a volunteering function, so I'm fully volunteering as a president of EUPATI Switzerland. My actual workplace is, as it happens, the AO Foundation, which as you may have noticed is also partnering with the Davos Digital Forum. That's more like of a coincidence. So here and today I'm talking as in my function as president of EUPATI Switzerland. So just to be clear on that and precise. So I would like to not only talk about EUPATI and the role of EUPATI in actually educating patients, but I also want to start maybe with a short introduction to patient and public engagement, and just to make clear that we talk about the same thing, or that we are clear what I try to talk about. Then, of course, introduce the European Patient Academy, that's EUPATI, and then also maybe highlight a few things or add a few thoughts on the digitally engaged patient, because we are in the digital forum, so we talk about digital, and that's what I also try. And then, of course, challenges, solutions, and I hope we still have a little bit of time for a discussion as well. So, terminology, as mentioned, I just want to be clear on what we talk about, because patient public involvement is often referenced, or we often reference to patient public involvement when we talk about that, and this is abbreviated by PPI. I just out of the blue, basically, I thought, okay, let's Google for it. So if I Google for patient public involvement, then I actually end up with 189 million hits. That's quite a bit. So you could say, well, okay, I should have actually focused more and really more specifically Google for PPI in healthcare or healthcare research. Maybe I would end up with some less. But when you scroll through the results, actually, at least on the first few pages, I didn't scroll through all the pages, obviously, then you will find that actually the PPI is very often associated with health research anyway in Google. So it seems to be a quite common concept already, you would imagine. And I think that's also true when you think, I think everybody in healthcare probably has heard the term somewhere and is even maybe talking about it. But I think when we go deeper, then we realize that we are probably still somehow at the beginning of patient and public involvement still. I try to give you a few examples through the talk, maybe to also highlight that. So one thing to start with and to continue with terminology is that once you start talking about or discussing about patient engagement, patient public engagement in healthcare, then you quickly realize that quite often people actually don't really understand exactly the same. So once you start discussing the topic, you often realize that first you have to kind of make a step back and make sure that everybody in the room or in the discussion round actually is understanding the same and can refocus on what we are actually really talking about. So I just listed a few terms here that you may hear. So it's patient engagement, patient involvement, then also functions or roles. So patient representatives, we talk about patient advocates, patient activists. Some of these terms and some of these roles may actually be synonymous or may be the same, but I would say it even may depend on, let's say, on the indication of the actual condition or disease you are discussing about patient involvement. It may be slightly different. If you talk about patient involvement in an oncology setting, it might be slightly different when you talk about patient involvement in HIV or when you talk about patient involvement in a Alzheimer trial. So the term is the same, but what it actually really means might actually differ. So it's recommendable to, whenever you start a discussion or when we start a discussion about patient engagement, patient public involvement, that we really clarify what we are talking about and what we mean with that. Allow me also, I think it's worthwhile still, and a little bit in the context of what I just said, is also that I try also to introduce quickly what PPI is, and maybe it's a little bit my personal view, or it's a little bit the view of also EUPATI, so what PPI actually is in our view. So again, I think PPI is actually connected to many aspects of healthcare. So as consumers of healthcare, patients get involved, of course, in very many kind of aspects of healthcare, and they also start interact or may interact with a large variety of key stakeholders. So PPI also affects, of course, health policy. It affects regulatory authorities. It affects the industry. It affects all kinds of healthcare professionals, advisory boards, and so on. So it's really a huge variety of activities, of stakeholders that are involved in this patient public involvement story, so to say. So we for sure cannot cover all the aspects. So what we try, or what I try, is, and what EUPATI is clearly doing, is focusing on patient public involvement in clinical research, not even in research or healthcare research. So really focusing on clinical research, and with that also we try to ensure that we are, let's say, not having too many activities or too many wishes coming up to us. So we really focus on clinical research and patient involvement in clinical research. Again, we have to define what really we mean with patient public involvement in clinical research. So I like the definition that is given by the British NIHR, Involve, and they say patient public involvement is an active partnership between patients and the public and researchers in the research process, rather than the use of people as subjects of research. So anyone involved in clinical research in the audience is aware that, especially in the pharmaceutical clinical research, we use the terminology subjects when we talk about study patients. So alone this fact is already kind of probably questionable, and you may see, even if we talk about patient public involvement for years or decades already in the guidelines, even in the regulatory authority, in the regulatory frameworks, the term subject is still used, right? A little bit more detailed. So patient public involvement in research is often defined as doing research with or by the people who use services, rather than to, about, or for them. So this would include, for example, involvement in the choice of research topics, assisting in the design, actually actively advising on the research project, or in carrying out the research. Just one or two words to involve. You can also see the link. Please feel free to click that link. So it was established in 1996 already, so quite a while ago. And it's part of the National Institute of Health Research in the UK. And of course, publicly funded, publicly supported. So a little bit more one reference I like to make, or one citation, is from Professor Dame Stanley Davis. She was CMO at the NIHR in 2015. So she said, no matter how complicated the research or how brilliant the research, patients and public always offer unique, invaluable insights. Therefore, when designing, implementing, and evaluating research, invariably makes studies more effective, more credible, and often more cost-effective. Now, allow me quickly to think about that statement. That's probably very true, and we all probably might agree to it. However, the big question always comes up: well, is there proof for it? So we all talk about evidence-based approaches, and that's always the big question. Well, how to prove that? And that is actually not such an easy question. There are many publications. I also added some links at the end where you can actually look up publications about impact of public and patient involvement in clinical research. However, the real proof on improved outcomes, clinical outcomes, when you involve patients actively in clinical research, that's quite a tricky thing, and that would actually require huge studies and heavily funded studies, and that is probably very difficult to find, if at all. So that definitely there is some room to do more research and to provide more studies on it. Okay, so yeah, so let me point out some additional points. So in public and patient involvement, of course, one of the big questions is finding out about the real needs of the patients. How can we actually find out what is the patient's need? How really to actively involve? It's quickly said, but how do we actually really in practice to involve patients? How can we actually make active participations of patients happen? Further down, how actually can we involve patients in developing maybe the right measures? I just added one link, which is really worthwhile to look up if not already known. So ISOQOL, this is an organization focusing on that aspect. And of course, then when you do a study, include the right and the adequate measures for the patient involvement. And of course, big questions, challenges in patient engagement. Just want to go through a few of these, just to highlight or to point out how actually challenging the whole thing is. It's quickly said as before, but really do it. So one big question: who actually is the patient? And what is her or his needs? The health issue actually may be shared. So just allow me, COVID is of course in everybody's mouth, so allow me make the example. So COVID as a virus is probably quite identical for everyone, except of course the mutations, but they are not really not surprised, but actually are expected. So the virus itself is actually pretty identical for everybody. But how about the patients, the affected patients? From newborn to high age, from healthy to affected by multiple comorbidities, from well-educated to analphabetic, from super rich to very poor. So the actual patient is super diverse, right? And of course, that's true also for the public. And also then that leads probably to the question or the conclusion, well, actually, who actually really can advocate for a patient, or can actually really an advocate speak for all the patients? So this is probably quite a big challenge. Further down, of course, also public interest actually may not always be the same as the patient's interest, or you could even imagine that public interest maybe is totally opposite to the actual patient's interest. So all these questions, you realize probably it's not so easy to really include patients fully. And so on. So other challenges: how to finance patient engagement. So you may know most of the patient groups or patient activist groups actually are really not very well financed. They struggle for finance. That's true also for EUPATI, by the way. And of course, then totally different to financing. What about patients who cannot speak for themselves? For example, psychic disorder, mentally challenged children, dementia, and so on. So these patients cannot really talk about themselves, but you have to find ways to also find out about their needs. Right. And how to enable patients to talk. So is every patient ready to really present in an event like this? Or is a patient ready to talk to industry? Is a patient ready to talk to authorities? And that really brings me now to probably the reason why I'm here. That brings me to EUPATI, sorry, I have to click on that one. So to EUPATI, the European Patient Academy. So it was realized, or it was recognized that yes, indeed, to really enable patients to engage, we have to make sure that patients also understand about the topic. And that was really the initial idea and is still the mission of EUPATI. So you just see a few details here on the slide, how it was funded. And initially funded, of course, by European research funds. Then the European Patient Academy, so that's really kind of the core, let's say, core business of EUPATI. So it's really about patient engagement through education. That's the mission. So we want to make sure that patients are educated enough and fluent enough to really discuss the topic on eye level with whatever the stakeholder is, industry, authorities, and so on. The training we offer through EUPATI, again, you can access that through our homepage, of course, has been transformed just very recently. So it is now an online, fully virtual learning experience course. So there is no face-to-face anymore. It used to be a face-to-face. It's a manifold, it's really many courses that are available, and it's also a structured learning. So you can actually become a patient expert when you have actually gone through a defined number of courses, and you have also received the necessary certificate. So you get actually really a fully official proof that you have been trained, or that you are a trained patient and you have learned about the basics of clinical research. It also is costing a little bit of it, so it's not free of charge, at least to get the certificates. So access to all the courses is free of charge. So that's like open source. So everybody can access and run through the courses. But if you want to have a certificate, then you pay a small fee. And to become really a EUPATI fellow, as we call it, so when you really have trained all the necessary programs, the total cost would probably be at around 230 euros. So that's basically the total cost to become such a EUPATI fellow. There are other resources available on our homepage. So we have a toolbox, again, accessible against the registration, but you don't have to pay anything. A toolbox which really offers a lot of information about clinical research, focused a little bit on pharmaceutical, I may have to say right now at that time, but of course we also look into all the other aspects of clinical research, medical devices, academic research, and so on. Right, and now coming to EUPATI Switzerland. So EUPATI is a European organization, but organized in many countries in so-called country platforms. So many European countries, and actually even Japan is also another country. So also countries outside of the European Union, they have organized their own local EUPATI platform. In Switzerland, it's organized as an association by Swiss law, so fully not-for-profit, member-based association. The Swiss audience knows what that means, and that's what we are now. That's where we are active in Switzerland. So with that, I close about EUPATI. Just a few thoughts about the digital patient. So I think we all talk about digital patients, but I think we should really remember that, of course, patients are and remain human beings made by nature. So as digital as we want to get, the patient itself, himself, herself, still is a human being. And I think that's just to be recognized. And it kind of adds a challenge to become a patient advocate. So nowadays we as patients don't not have to kind of get knowledgeable about our condition to talk to stakeholders, but we also have to be knowledgeable about digital opportunities and challenges. So actually, I would say for the time being, it rather adds maybe challenges. But of course, I also totally agree. And I think we have nicely seen a few examples today where, of course, digital also offers opportunities. So, of course, accessibility to information, just as the EUPATI toolbox, that's digital age, that we can use internet to access all this information easily, that we can run through a virtual learning course at very low cost from anywhere in the world, whenever we want. That's digitalization. So that's obviously an opportunity. Plus, of course, the digital tools in clinical research, not only clinical research. First talk of this stream was about actually digital treatments, so to say. So not only in clinical research, but also in clinical research, we actually add digital gadgets, of course. Just one thought, question. We always have to think about who we actually involve. So a nice example again, COVID. So the canton of Zurich to implement the vaccination program, to get registered to vaccination, they implemented a nice internet platform, but somehow they forgot that the first group to be vaccinated is probably 80 plus, so very old people. And the way they had the internet platform was like buying a ticket for a concert, right? So first comes, first serves. That obviously is forgetting a little bit who is really the target. And the same is true for clinical research. So when you have online prompts, make sure that your patients in the study actually are ready and able to use these online gadgets. And if you have a study in Alzheimer, probably that might not be such a good idea, or dementia. So you have to really think about that and ask the right questions. So with that, I hope that I covered my points in the limited time I have, but I think you realize the topic is huge, so we could probably discuss hours and hours and days and days. I hope there's still time for one or two questions, though.
Oh, thank you, Ivo Schauwecker, for this really interesting talk. We have a question from the audience, from Sharmila Souza. Why citizen science approaches have not been more promoted, especially when it comes to health economics and outcomes research? And as a follow-up question, whether you think citizen science could actually help to engage patients and citizens in research policy and shared clinical decision-making?
I didn't really understand the first part of it. Sorry, could you quickly repeat?
So the question is why citizen science approaches have not been more promoted when it comes to health economics and outcomes research.
Yeah, it's a good question. I don't really know, and the thing is, maybe I admit that citizen science for me is a term which now again I would probably first have to really look it up to be sure what it means, right? So it's one of these things. So I said in the beginning, so there are many activities, many initiatives, there are many patient groups around. I mean, let's face it, alone in Switzerland we probably have at around 100 patient groups, right? And there are many initiatives, even private. So EUPATI is one of it, and it's always a bit the question could maybe also be how to make sure that we join forces. I think that is the relevant question. So there are so many activities ongoing and groups involving, even competing for funds. So maybe we should sit a little bit back, that's self-critical. So on our end, patient groups sit back a little bit and try also to find out how we actually could join forces to have a bigger impact. I think that's maybe, I'm not sure if that addresses the point, but otherwise I'm available also on LinkedIn, of course, and can always follow up on discussion.
Okay, perhaps as the next question. So if I'm a patient and I want to become involved in research and also as a patient representative, what would be my first steps to do?
Mm-hmm. Yeah, I think the first step, of course, is the doctors may hate me, but anyway, go to internet and Google for it. So you may find actually patient groups. It depends a bit on what kind of condition you have. So as an HIV patient, of course, it's easy. So you just go and you find most probably quite a few entry points. And ideally, I would say patient activists, patient groups probably then try to guide you through that. So contact them, become a member, become an active member of these groups. Another way, of course, EUPATI. I mean, you can go to EUPATI Switzerland. If you're in Switzerland, you can go to EUPATI Switzerland, become a member as a first step. And go to EUPATI Central, the homepage, the academy, and start your training. I mean, that's a very kind of low hurdle step. So you actually could really quite easily become engaged and start learning about what actually clinical research means for a patient, for a lay person.
Mm-hmm. And perhaps the other way around. So if I work in biomedical research, which I actually do, and I'm interested to perform a study involving patients.
Right.
Representatives, how would I get access to these appropriate educated patients?
Again, I would say if you really are focused on a condition, which is usually the case in the clinical research, then probably the best way is actually to look for patient groups already existing. If you are interested in more general topics, if you would look, for example, for lay persons or so, then again, EUPATI could be an entry point. However, I must warn here a little bit because we really don't have so many patient advocates or trained patient fellows available yet. So that's work in progress, right? So we are evolving, let's say, the group of patients we know who can actually be your partner. But that takes time, as you may understand. So yes, but I think one always can approach us, and we at least know the fellows, the EUPATI fellows in Europe, and we may actually make a contact to somebody who really could help as a patient representative in your specific study.
Okay, thank you a lot for your answers and for your presentation. It was certainly very interesting.
Thank you.
Thank you.